Tim, will our governmental leaders be required to follow the same rules as we will, as far as the insurance and so forth? Will they be able to get other insurance, or are they going to follow the same patterns that we follow?
Under what has been passed?
Yes.
They put in the provision that they will come under the same, but committee staff, Senate committee staff, executive office, White House staff are not under this passed bill.
I mean, is that something that could be submitted? I'm thinking if they, if they have to play by the same rules, I think we'd all be in pretty good shape.
And I've signed a contract out there saying that if I were to vote on health care reform, and it would be a plan that had no choice, I would live under the same plan.
That might be a great movement to put forth with some of our other leaders.
Yeah. But I think the best thing to push for is that we get the government out of health care, including providing for legislators. You know, a number of years ago, U.S. Congress, let me say this, the State House, during my last several years in office, we did away with the defined benefit plan for our pensions. We put a copay on our health care. And that wasn't before then. That's been a good thing. Congress needs to do the same thing. Years ago, they did do away with their very salty pension plan. And now it's 401k. And I didn't leave office when I was retired, involuntarily, but retired nonetheless. I didn't leave with any benefits, other than what I accrued that I put in my own 401k plan for my own money. So, no, you're absolutely right. We ought to expect Congress to live under the same thing that the country lives under, and that ought to be a mandate. But don't put the government in caring for the health. So. Yes, sir.
Yeah, Tim, one of the things that we haven't talked about with healthcare is the use of medical schools. Many years ago, my oldest daughter was a heart transplant patient at Stanford, and they wanted, you know, she needed a heart transplant, they wanted her. It was research at the time. How are you using medical schools for medical care in this?
Yeah, these are all options that we ought to be creative in thinking about. How do we reduce the cost of healthcare and increase the results? You know, continue to increase the good outcomes of healthcare. And certainly one way would be to use our training institutions more effectively.
I was thinking of this in the instances of pre-existing conditions. I mean, if I can't afford insurance, there's hospitals or medical schools who are probably studying my pre-existing condition. Like, you know, I don't need to go to the hospital in town. I need to find a school that's studying it and go there. Who did it?
These are creative ideas that come and are generated from the bottom up. And government that takes the top-down approach squashes that. You know, I had some of the best dental hygiene care while my daughter was at Lansing Community College training to be a dental hygienist.
Right on.
She required me, as her dad, required me to bring my whole office across the street from the Capitol to be her guinea pigs as she ground and worked on our teeth. But you know, it wasn't